Mental health, suitable for 9th through 12th graders. Anyone can be affected, despite their level of success or their place on the food chain. In fact, there is a good chance you know someone who is struggling with it, since nearly 20% of American adults face some form of mental illness in their lifetime. So why aren't we talking about it? What is mental health? First, let's define physical health. Physical health includes fitness, agility, cardiovascular condition, endurance, and muscular strength. Exercise and eating well are the two main components of physical health. If you exercise and eat well, you will have good physical health. If you don't exercise and eat well, you could develop physical conditions. Sleep also plays an important part in both physical health and a little bit mental health. Whereas mental health includes your emotional, psychological, and social well-being. It affects how we think, feel, act, handle stressors, relate to others, make choices. Like physical health conditions, there may be many mental health conditions too. Biological factors, life experiences, and family history can all contribute to the development of mental health conditions. There are many ways to keep up good mental health. People who have positive mental health can realize their full potential, cope with the stresses of life, work productively, make meaningful contributions to their society. What is mental illness? Again, let's compare physical illness to mental illness because we are all more familiar with physical illness. So physical illness relates to something going wrong in the body. Maybe you have a cold or your body's fighting off the flu or something. You could also have a cut or a broken bone and your body has to heal itself. Mental illness relates to an illness in the brain. Just like how you can take medicine and get treatment when you're physically sick, there are also many treatment options so that you can get better when you're mentally sick. Early warning signs of mental illness: eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing that things are not true, thinking of harming yourself or others, inability to perform daily tasks like taking care of your kids or going to work or school. Stress: a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. A state resulting from stress. Stress can happen anywhere at any time. Most likely, your stress will be caused by school, sports, and/or family. School-specific stress. If you are struggling with classes, get tutoring. There are many tutoring organizations all over. Some even offer free tutoring. If you are struggling with a teacher or another student, talk to an adult you trust to help you. Family and sports-specific stress. Family stress is hard to combat, but I would use a coping kit I talk about later to help you deal with it. With sports stress, talk to your parents or counselors if you're having issues with coaches and other students. You can also talk to your coach about other students that may be causing you stress, or things within that sport that may be causing you stress. Is stress a mental illness? No. Everyone experiences stress, some on a daily basis. However, if someone is experiencing a lot of stress in high amounts, it could lead to anxiety or depression, which can be disorders and illnesses. It's important to learn how to minimize stress and how to deal with it in a healthy way, so you do not find yourself dealing with a mental illness. Anxiety: apprehensive uneasiness or nervousness, usually over an impending or anticipated illness. A state of being anxious. You can be anxious almost over anything. However, nervousness is not anxiety. Everybody is nervous at times. Anxiety is more like excessive nervousness. Is it nerves or an anxiety disorder? For nervousness, the symptoms are upset stomach and nausea, rapid heartbeat, bad breath, tics and tremors, dry mouth, sweaty hands, breathlessness, trembling, hot or cold flashes, difficulty concentrating, muscle tension, feeling restless and agitated, dizziness or feeling lightheaded. Anxiety disorder symptoms are headaches, odd sensations in your body, numbness, body aches and pains, irritability, shaking or trembling, insomnia, trouble concentrating, rapid heartbeat, chest tightness, fatigue, stomach aches, diarrhea, sweating. So there's similar ones, and there's also some different ones between nervousness and anxiety. Generalized anxiety disorder, or just lesser anxiety. Many people do have anxiety, especially teens. However, most of them do not have an actual disorder that needs to be treated with medications therapy. There are still many ways to cope with someone who suffers from a less severe form of anxiety. This is the generalized anxiety disorder, or GAD, symptoms. This is the most common form of anxiety disorder that we'll be looking at, but there's a lot of others that exist. What do doctors and mental health professionals do to diagnose GAD? They do a physical exam to look for signs of anxiety that might be linked to medications or other medical conditions, order blood tests, ask detailed questions about your symptoms, use psychological questionnaires, and use the criteria listed on the Diagnostics and Statistical Manual of Mental Disorders, DSM-5, published by the American Psychiatric Association. Questions your doctor may ask when deciding if you have GAD or not. What are your symptoms? What things do you tend to worry about? Do your symptoms interfere with your daily activities? Do you avoid anything because of your anxiety? Have your feelings of anxiety been occasional or continuous? When did you first begin noticing your anxiety? Does anything in particular seem to trigger your anxiety or make it worse? What, if anything, seems to improve your feelings of anxiety? What, if any, physical or mental health conditions do you have? What traumatic experiences have you had recently or in the past? Do you regularly drink alcohol or use recreational drugs? Do you have any blood relatives with anxiety or other mental health conditions, such as depression? Common treatments for GAD: psychotherapy, talk therapy, cognitive behavioral therapy, medications, antidepressant, buspirone, benzodiazepines. Often both psychotherapy and medications are used together to treat GAD. Ways to cope if you experience any level of severity of anxiety or if you're nervous. Keep physically active. Develop a routine so that you're physically active most days of the week. Exercise is a powerful stress reducer. It may improve your mood and help you stay healthy. Start out slowly and gradually increase the amount and intensity of your activities. Make sleep a priority. Do what you can to make sure you are getting enough sleep. Use relaxation techniques. Visualization techniques, meditation, and yoga are examples of relaxation techniques that can ease anxiety. Eat healthy. Healthy eating, such as focusing on vegetables, fruits, whole grains, and fish, may be linked to reduce anxiety, but more research is needed. Avoid alcohol and recreational drugs, and quit smoking and cut back or quit drinking coffee. Depression, the state of feeling sad, dejection. A mood disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, a significant increase or decrease in appetite and time spent sleeping, feelings of dejection and hopelessness, and sometimes suicidal tendencies. Everyone has moments of being depressed. It's part of human emotions. Some people start being depressed a lot and for very long amounts of time. Long-term depression is what you want to avoid. Long-term depression is more the actual illness. Is it sadness or depression? For sadness symptoms, some people are quiet, withdrawn, or exhibit very little energy. Others are being exuberant and energetic to compensate for their feelings, having anxiety, emptiness, hopelessness, pessimism, guilt, worthlessness, loss of interest in activities or hobbies, feeling tired, difficulty making decisions. All sadness symptoms are temporary. Depression symptoms: persistent sadness, anxiety, and/or empty mood, feelings of hopelessness and pessimism, feelings of guilt, worthlessness, and/or helplessness, loss of interest in hobbies and activities, decreased energy, fatigue, and/or being slowed down, difficulty concentrating, remembering, and/or making decisions, insomnia, early morning awakening, and/or oversleeping, loss of appetite and/or weight loss or overeating, and/or weight gain, thoughts of death or suicide and/or suicide attempts, restlessness and/or irritability, persistent physical symptoms that do not respond to treatment, such as headaches, digestive disorders, and chronic pain. Depression symptoms are long-term. Sadness versus depressive disorders like MDD. Sadness and depression have many similar symptoms and signs, however, there are many differences. The biggest difference is that the symptoms of sadness are temporary. They may only last a few days. Depressive disorders like MMD, aka major depressive disorder, are shown to have symptoms like sadness, however they last really long. They are often more severe. Generally, sad people do not suffer intrusive thoughts or have a change in eating habits. People who suffer with depression often do feel those more severe symptoms. Early signs of depression or signs of sadness turning into depression. Questions that you can ask your doctor when deciding if you have MDD or if you're just diagnosed with MDD. Is depression the most likely cause of my symptoms? What are other possible causes for my symptoms? What kind of test will I need? What treatment is likely to work best for me? What are the alternatives to the primary approach that you're suggesting? I have these other health conditions. How can I best manage them together? Are there any restrictions I need to follow? Should I see a psychiatrist or other mental health professional? What are the main side effects of the medications you're recommending? Is there a generic alternative to the medicine you're prescribing? Are there any brochures or other printed materials I can have? What websites do you recommend? Common treatments for MDD. Medications. You have selective serotonin reuptake inhibitors, or SSRIs. And you have serotonin norepinephrine reuptake inhibitors, SNRIs. Atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors, MAOIs. You have psychotherapy, hospital and residential treatment, and electroconvulsive therapy, ECT, and also transcranial magnetic stimulation, TMS. Sometimes mind-body connections can help improve MDD. Some of these connections can be stuff like acupuncture, relaxation techniques such as yoga or tai chi, meditation, guided imagery, massage therapy, music or art therapy, spirituality, aerobic exercise. Ways to cope with sadness or depression. Simplify your life. Write in a journal. Read reputable self-help books and websites. Locate help groups. Don't become isolated. Learn ways to relax and manage your stress. Structure your time. Don't make important decisions when you're down. Body image. A subjective picture of one's own physical appearance established both by self-observation and by noting the reactions of others. Body image is the view someone has about themselves, generally relating to physique. Body image can be both good and bad. Some people really like how they look. They have positive body image. Others do not like how they look. They have a negative body image. Unfortunately for many people, they have a more negative feel towards their body, which can lead to depression, anxiety, and body image issues, along with others. Is body image a mental health disorder? No, body image is simply a term used to describe how one sees themselves. People can have good body image and people can have bad. People who have a negative view on their body can develop a mental health disorder called body dysmorphic disorder, which is a mental illness. What is body dysmorphic disorder? BDD. BDD is a psychological disorder where people will misinterpret and then obsess over a flaw. The flaws are small, and most are not even existent. People who have BDD may wear lots of makeup, obsess over makeup, struggle with depression, have social anxiety, dislike going out in public. Body dysmorphic disorder affects 1.7 to 2.9 of the general population, about 1 in 50 people. The most common flaws. Skin, usually facial skin, for example, perceived scarring, blemishes, or color. Hair, for example, perceiving balding, or too much facial or body hair. Nose, for example, shape and size. Common repetitive behaviors that people with BDD do. They camouflage, comparing, mirror checking, excessive grooming, reassurance seeking, questioning from others, skin picking, clothes changes, tanning, excessive exercise or weightlifting, excessive shopping, seeking cosmetic surgery, dermatologic treatment and or other cosmetic procedures, and social anxiety and avoidance. How is BDD diagnosed? A healthcare professional will use the DSM-5 criteria to diagnose someone with BDD. DSM-5 criteria for BDD: appearance preoccupations, repetitive behaviors, clinical significance, differentiation from an eating disorder, and then specifiers. You can read through this. Common treatments for BDD: cognitive behavioral therapy, mere exposure therapy. Social phobia. Social anxiety disorder, also called social phobia, is a mental health condition. It is an intense, persistent fear of being watched and judged by others. This fear can affect work, school, and/or other day-to-day activities. Social anxiety disorder versus nervousness in crowds. It is normal for people to feel scared or nervous when having to do something in front of people. Most people are nervous, but are able to function at a high level in front of others. However, when put in front of a crowd, some people completely shut down and are unable to function at a reasonable level. Symptoms of SAD or social anxiety disorder: fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fear that others will notice that you look anxious, fear of physical symptoms that may cause you embarrassment, such as blushing, sweating, trembling, and/or having a shaky voice, avoiding doing things or speaking to people out of fear of an embarrassment, avoid situations where you might be the center of attention, having anxiety in anticipation of a feared activity or event, enduring a social situation with intense fear or anxiety, spending time after a social situation analyzing your performance and identifying flaws in your interactions, expecting the worst possible consequences from a negative experience during a social situation. Physical symptoms of SAD: blushing, fast heartbeat, trembling, sweating, upset stomach or nausea, trouble catching your breath, dizziness or lightheadedness, feeling your mind has gone blank, muscle tension, staying away from common social situations. Special types of SAD. So for children, it's interacting with adults or peers, and there's also performance type. How mental health professionals diagnose SAD: a physical exam, a discussion of the symptoms, a review of a list of situations, self-report questionnaires, and criteria on the DSM-5. DSM-5 criteria: persistent intense fear of anxiety about specific social situations, avoidance of social anxiety producing social situations, excessive anxiety that's out of proportion to the situation, anxiety or distress that interferes with your daily living, fear or anxiety that is not explained by a medical condition, medicine, or substance abuse. Treatment for SAD: psychotherapy, antidepressant drugs, other drugs. Other phobias: extreme or irrational fear or dislike of a specific thing or group. So here's a list of different types of phobias. Fear versus phobia. Everyone is scared of things. Let's take height, for example. It can be scary to be up high because if you fall, well, that would be bad. However, you can still manage heights and be functional. A phobia is when you're so afraid of something, when faced with a thing, you're no longer able to function normally. Symptoms of phobias. Feeling unsteady, dizzy, lightheaded, or faint. Feeling like you are choking. A pounding heart, palpitations, or accelerated heart rate. Chest pain or tightness in the chest, sweating, hot or cold flashes, shortness of breath or a smothering sensation, nausea, vomiting or diarrhea, numbness or tingling sensations, trembling or shaking, stress, a loss of control, being overwhelmed, embarrassment, anxiety, depression. Diagnosis and treatment. Luckily, people who suffer from a phobia are usually aware they suffer from them and admit they do, so they are more likely to get treatment. Cognitive behavioral therapy, beta blockers, antidepressants, and exposure therapy are all common treatments. Coping kit. Why make a coping kit? We are going to build a coping kit, sort of like the ones above, but a little different. Coping kits are important because they can help when feeling stressed, anxious, sad, etc. These can be beneficial for anyone, mental illness or not. So we're going to put in deep breathing, progressive muscle relaxation, optional stress ball, write it out, talk back to worries and reframe thoughts, and get help from an adult. For deep breathing, you inhale, and then you want to make sure your stomach expands, really breathe in a lot of air. And then when you exhale, you want your belly to contract, and you also want your exhale to last longer than your inhale. So for instance, a common thing to do would be inhale for 4 counts, and exhale for 5, 6, 7, 8 counts. Make sure your belly is going out and then in, and the breath should be deep and slow. Here is progressive muscle relaxation. It's where you contract one part of your muscles at a time, and then you relax it, then you move on to another set of muscles. Generally, people start the feet and go up to the head, or they start the head and go down to the feet, and they do one group of muscles at a time. Stress balls. Here's just some different stress balls examples. Write it out. Write in a notebook or a piece of paper. Write whatever comes to your mind. Use this emotion chart to help you identify how you are feeling. You do not need to share this writing with anyone. Reframing thoughts. Reframing is where you ask a series of questions about what is worrying us to see why and if we should be worrying about it. So the first step is to name a worry you have right now. The second step is to figure out what that worry is telling you. The third step is figuring out if that worry is accurate and is it worth some worrying about. And the fourth step is how can we change the worry into a positive thought. Talk with an adult. Sometimes it does help to talk with an adult. So if you have an adult you can trust, definitely talk to them about any issues you're having. Meditation techniques. Meditation is a great way to help relieve the symptoms of anxiety, depression, anger, body image, stress, and social phobias. There are many different types of meditation. Focusing on breath is highly thought of as a good way to help ease anxiety and stress. To do the 4-7-8 technique, you inhale slowly for 4 counts, hold the breath for 7, and then breathe out slowly for 8 counts. This 4-7-8 technique has been proven to help with mental health and sleep.